Hey Erica, how are you?
I'm doing good. How are you, Dr. Huntley?
I'm good. I'm excited to have you on the podcast for this episode. And we've been chatting for a few minutes before I hit record, so I'm really ready to dive into the questions. I think for the very beginning, for people who don't know you yet, how about you just take a minute and introduce yourself?
I'm super excited to be here as well. My name is Ericka Horne. I am currently a Doctor of Public Health student. I am concentrating in behavioral science and health education, but I also have a master's degree in public health and I have certificates in health education and promotion as well as epidemiology. And I am also the CEO and founder of Akcire Consulting, which is my new consulting business.
I'm so excited for you. Yes, everything you just said. Yes, yes, yes. um, for everyone, listening to this podcast, who may not have the video, we're actually recording with video, and Erica is very special to me. She was at our expo in Orlando earlier this year, and we've just had the opportunity. Actually, if I roll back the end of last year at APHA. We're in
Yes.
Boston.
No,
We're at an
mhm.
event, and she came up to me and she's like, "Oh my gosh, it's Dr. Huntley!" And then you just went to, "I listened to your podcast," and this. I was like, "Oh wow!" Because it's the
Yes.
end of the day, and I loved your energy. I was so tired, so I wasn't like catching everything you were saying. But it was so nice to meet you then and to have gotten to know you over some time and have you join in Orlando. So I'm genuinely excited to have you here on this podcast with me today.
I'm excited to be here as well. And the energy is still the same ever since the first time we met.
We had a great time in Orlando, and I'm excited about all the things that we're going to be discussing on this podcast. So let's start with one of my favorite questions. And I will say this up front. Thank you. I know you said you woke up with a bit of a scratchy throat or hoarseness today, and you're joining me with your cup of tea. You're committed. I appreciate that. So if you need to pause and get a drink of tea or a little bit of water, I understand. I just appreciate you being here.
Thank you.
So, one of my favorite questions to ask is, helps me get to know the journey, to like, how did you get here? So, my first question is, when did you first learn about public health or first become interested in public health?
I really love that question because it always allows me to go back and think about how I actually got here. So I always thought or knew I was going to be a doctor. So, as most people, you go to school to go to medical school. That journey didn't really take off the way I thought it was going to take off, but I still was trying to pursue clinical medicine. So I got my medical assistant license and I was working and I was in a doctor's office. And it was at the time that everything was beginning to seem routine. Every day I was seeing the same or similar patients with the similar diagnoses. And I noticed a pattern of us always giving them the same information. And I said, there has to be a better way than saying this multiple times a day because we have to be able to just tell everybody at once, like, why is it taking so long and why are we having these different adverse health outcomes? And for me, I've always been a problem solver. So I'm trying to figure out how to solve this problem. So at the same time, I started volunteering with my church in our health ministry, and we would put on health fairs. And my thought process behind it was, let's bring the people to the church so they can give the information out to the people because they may not make it, or sometimes it's just easier to give it all at one time. So it was during that time where someone actually introduced the term public health to me, and I realized it was actually what I was already doing. So I always had this passion for making sure that people were aware of different health things that were going on and bringing information to people. But I didn't realize that there was a term behind it. And so while I was working, I left the doctor's office and was working in the emergency room. And that's when I learned about getting the Master of Public Health. And that's what shifted my whole focus in my career path.
Oh, I love that story. And it's you're not alone. A lot of us discover, start out pre-med route because we have this heart and we this connection to health and people, and we
Mhm.
think, "Oh, that's the way to go." And then we learn about public health somewhere along that path. So, wonderful. Is there a population or condition or like a public health problem or issue that you are most passionate about?
I would say right now, my main passion or my top focus would be diabetes management, diabetes prevention, anything related to diabetes. Overall, all chronic diseases, but I'm focusing right now on diabetes only because a lot of times people with chronic diseases think, oh, well, it's not something that's fatal or it's not going to kill me and I can just live with it. So they'd rather, you know, not take the necessary precautions to not let the diseases or the illnesses get any worse. So I feel like if we can bring more education and more information and awareness about how to live longer lives with these chronic diseases, including diabetes, then that's the area I want to start with. That's the area I want to focus in right now.
Yeah, I can definitely understand that. We were also chatting about this a little bit before we got started, the topic of diabetes, and I feel almost like a full circle type of focal moment for me because I started when I first started my master's of public health, at first entry into grad school, my shift away from infectious disease. I mean, I had always worked on infectious disease, and to that point, into chronic disease, landed me right in diabetes, and for a lot
Wow.
of personal reasons, myself having that had been on that journey since I was pregnant with my daughter, and it's a huge part of my family's burden on my mother's side. And I've watched so many of my family members die far too early, too young from complications of diabetes. And then in the community, beyond my family, my church community,
Mhm.
and you and I both live here in the southeastern region
Mhm.
of the U.S. And I've lived, up north and northeast, but it's just something very unique about our perspective and the attitudes around a lot of these chronic diseases. Like, you think about diabetes and you automatically kind of attach high blood pressure and high
Yeah.
cholesterol and a lot of the others.
Yes.
And so here in the Southeast, there's a certain attitude and positioning around these chronic diseases. And just like you described, it's almost like a lot is taken for granted. And I still, you know, my public health hat on, and thinking retrospectively, because I don't think I've always looked at it this way, but I think a lot of that really goes to generation after generation after generation. This is kind of instilled, but education, like really uh, clear messages where we're not preaching to people, telling them what they need to do, but really partnering with the community
Yeah.
and having conversations and really leading with our care. And
Yes.
we are not the experts of our communities always, but
Mhm.
they teach us, what we how we can partner with them. It's not just
Yes.
preaching and teaching to them, but the education is has a different meaning. It's very mutual and kind of synergistic. And so I just think that in what you're describing, in your passion, that there's so many opportunities and there's so many gaps, where a lot of well-intentioned organizations, want to do these things, but there are a lot of gaps in, actually meeting the needs of the community. So
Yes, you actually said something that really speaks to me as far as making sure or ensuring that we're partnering with the community. I know a lot of times we're very, because we may be knowledgeable in, the skills or the tools, a lot of times we don't take into consideration the community that we're serving. So
mhm.
while it's important to know the necessary tools to help them, we have to understand the why. Why do they do what they do? Understand why they believe what they believe and how we can actually help them in what they believe to actually live those healthier, longer lives. So I
Yeah.
definitely agree.
Honestly, I'm going to go a little bit. We're going to park it here for just a moment because I think I just remembered something that stood out to me when we were in Orlando. And we were talking about uh, really about the communities, right? The
Yeah.
communities we serve, and like what you said, talking and communicating with communities. What was really eye opening to me is we were a group of, anybody passing by, a group of all Black people in this room having this conversation. But when we got into the conversation, there were so many differences and so much that I won't say separated us, but made us so unique. very
Yes.
individual. You're Jamaican American. We had,
Yeah.
Haitian American.
Mm.
We had African American by definition. We had, British Jamaican American. We had
Yeah.
so many combinations in this room, and
Mhm.
realizing that um, there are so many nuances in each of our backgrounds and heritage, and how, so when you think of a community, if we were all to live in the same neighborhood, that's still multiple communities within that community, right? So
Yes. Yes.
so there's so much. I keep threatening to have a whole podcast on like this one day, and I may, but there's so much to consider, and we can't just walk into like any other, Black person could just walk into a community and even assume that they're going to be able to relate to every other Black person in the community, because
That's
there
true.
are so many differences, right? I feel like I'm preaching. But that was just a really that was insightful, from that trip, and it just points to uh, for all of us to realize that, how much more our broader population needs to be able to understand and realize, and then other niche communities of color, and how there's so many different layers there. So
Mhm.
just a lot to think about, a lot of opportunities to really connect with communities, and that part of education is just, it goes both ways. There's a lot for us to learn as
Yeah.
maybe the educator, and there's a lot for our communities to learn as well. So I told you I was going to park there for a minute, but that, I felt like that was like the perfect
It
opportunity to kind of go
was.
into some of that.
It definitely was.
So let's talk a little bit more about what you do. You're with your business. You mentioned your business. I want you to say the name again, because I want to actually be able to write it down. When we talked before, you didn't have the name. So let's talk a little bit more about your business and what you do, who you serve.
So my business is Akcire. So it's Akcire Consulting. And what I do is I provide program planning, implementation, support to churches, nonprofits, faith-based organizations that are looking to put on public health programming or any kind of health programming. So there are a lot of organizations that have funding and they're supposed to do something related to health, for the groups that they serve. Churches may be interested in putting on a health program. Different mentoring organizations that I've worked with before, they like to put on health programmings, whether they're health fairs or just awareness events. So I provide support in helping to plan those different events, help with implementing the event all the way through the day of. And then I also provide public speaking for those events if it's needed. So speaking on those different topics, different health topics, chronic diseases, and for the mentoring organizations for the youth, speaking on adolescent health also. Those are some services that I provide.
That is wonderful. The churches, is there any special reason you decided to focus on serving the communities at the churches?
I I spend a lot of my time at church. I'm I,
Yeah.
I am a Christian woman, and I do spend a lot of my time in church. And I noticed, even from growing up in a more Jamaican church, even now to the church that I currently serve, and though they're not Jamaican primarily, there are a lot of African Americans, and a lot of times we're not spending our time or understanding what the doctors are saying when we're going. I receive a lot of questions all the time from those that used to go to the doctor office I used to work with. They were like, "Hey, so I have this question about my labs, or I have this question about this." And it made me understand that even though some people may be going, there's still a lack of understanding of how it relates to them individually. So a lot of what I'm doing, or I have done, is been speaking to different women's ministries at different events that they host, just talking about the importance of one, going to the doctor, getting informed about what's going on, and advocating for their own health. And it's very important because a lot of times, unless they receive that information from an organization that they believe in, that they trust, a trusted leader, then they're less likely to go. So that's why it's important for me to be able to speak back at churches and provide that information to them.
I love it. Uh, there's there's such a power in collaborating with faith-based organizations. Public health knows this. I mean, this is
Yeah.
very like well established, right? So I think that for I love this for so many different reasons. Um, you already are such a part of, your church and the organization, so that makes it so easy for you, right? To
Mhm.
Because you're in the community, and so when you're collaborating with the churches, your established, rapport and connection and trust uh, is already like your baseline, and I think that it makes for a great opportunity for you to partner with the communities, the women's groups, the children, and share the information. Collect, receive the information, share the information with them, which allows them the opportunity to then, receive from you, truth and not, this misinformation that floats around everywhere.
Yeah.
Um, and for you to really be a part of improving health and seeing improved outcomes and helping them get um, resources, and which is, when we serve a community, whatever the community we choose to niche down to, we usually have some real connection there, so it gives us an opportunity to really have a greater impact and to show up because our heart's
Mhm.
already there, so I love that for you, and I know you really well, so I know that that's such a great fit.
Yes, thank you. Thank you.
So let's talk a little bit about, well, before I move on, let's go back a little bit to some of the services you mentioned. Speaking, like, so if they partner with you, the churches partner with you for an event, then you will also offer to facilitate or to speak or to provide those services to help planning and that type of thing as well.
Yes, yes. Help
Okay.
planning the events, hosting the event if needed, speaking for the event, finding speakers, finding the different resources and bringing them in if they need. If there's a specific topic they want to cover, if they want to talk about diabetes this month, or they're wanting to do just an overall health fair and they want to provide health testing, finding ways for them to receive those services wherever they are, and
I
trying to
love
meet
that.
them where they are.
Yeah, I love that. I think that there's such an opportunity. My goodness, health fairs. I was actually going to suggest diabetes. Diabetes education through these faith-based partnerships is really very, I won't say just popular, but well received,
Mhm.
um, and very impactful. And I think that I'm just kind of brainstorming, right? So, my brain will do that sometimes, but I think that there's just incredible opportunity because, for example, type 2 diabetes, back when I was, younger, for different reasons, the younger people were not really seeing the higher prevalence.
Mhm.
Now, it's a whole different world. And so you being able to connect and share on these topics as a young person is, I think, really a very powerful positioning. So, um, and we're both, like I said, here in the Southeast, and diabetes is a huge issue. And just the
They
ability to be able to come into the community with something like this is great. Okay. Let's pivot a little bit, and I would love to talk about this is where I call connecting the dots. I have two questions that I want to ask of you, and it's not like I'm looking for a textbook definition, right? But I think that for people to hear how you're applying these terms and what it means to you helps them to kind of formulate their own unique understanding and applied definition of these terms. So let's start with public health. How does the understanding of public health help you better serve your clients and community and have a greater impact overall?
So for me, understanding public health allows me to realize that it is more than the individual. It's a group. That means that different interventions or things that I do should be able to go beyond just one person, and the reach should be to multiple persons at different levels depending on where they are, and being able to meet people and the different groups and their different subgroups wherever they are. So for me, that's what the understanding of public health does for me. It allows me to see that there's more to than just what you see. There's more to what you visibly see, but there's different layers that I have to go deep to uncover so that I can effectively help the community.
It's wonderful. It's a great definition there. Um, and what about in that same kind of frame there? How does the understanding of epidemiology help you, better serve your community and have a greater impact overall?
So, looking at epidemiology, it allows me to understand more of the severity or lack thereof of how the different illnesses or diseases are impacting the communities I want to serve and that I am serving. If there isn't much information, then that's a flag to say, hey, we need to do more, whether it's through research or anything to get more information out. If we do have the research that's available, it lets me see how severe the issue is within the specific groups, different communities, and it allows me to tailor how I do what I do, which interventions are going to get the greater attention, like which ones are going to get more funding, which ones are going to get the greatest need at this time to help reduce, the disparities that may be seen. But that's how I use the epidemiology to help me understand and kind of just rank things and have an understanding overall of how things are being impacted in different communities.
Excellent. Like that. This is fun. I really enjoy getting to hear from you and knowing more about what you do and what's on your heart. So I'm really enjoying this conversation. My next question is really considering my audience. I have a broad, and I won't say really broad. We're all a little niche in my audience, but I do have a diverse, I could say, audience of listeners on the podcast. So we have students, professionals of different levels, entrepreneurs. We have folks that are not even in public health, but are thinking about, want to learn and want to understand public health. So, what is, any bit or of advice or tip that you could share with someone who's listening and may also be interested in working in a similar niche as you?
The advice I would give would be to let your passions drive you, to be intentional, and to be authentic at all times. As long as you let your passions drive you and you're not worried about what the other person or the next person's doing, you're going to keep going. When you get, a lot of times people get distracted because they don't know where to go or they see everybody else doing so many different things. But you have to be passionate about what you're passionate about. You can't change that, you can't change what you're passionate about. So let that be what drives you, and then be intentional on those things that do drive you, and then learn to be authentically you. It's okay if you're not everyone's cup of tea. That's okay. They can drink water, soda, or something else, but be authentic to yourself, be authentic to your true self, and be comfortable in the skin that you're in and with the work that you're doing.
Oh, that's so good. I really like that. I really like that. Thank you so much for sharing such great insights and just taking the time to be here, especially knowing that you've got that hoarseness and scratchy throat today.
Well,
But I really appreciate you coming on the podcast and sharing so generously with everyone. So
thank
thank
you
you.
so much for having me. It definitely is a pleasure.